Hi everyone, my name's Janelle. I'm a functional nutritionist who lives and plays in the Sierra Mountains, and this is my podcast where we talk about functional health with a mountain twist in 30 minutes or less. Today, I'm talking with my amazing friend, Caroline Corassanti. Caroline is a physical therapist who specializes in women's health and women's pelvic floor health. This is one of my favorite discussions. Caroline and I dig into what pelvic health is, how it is so misunderstood by women and practitioners alike, how it changes at midlife, and what you can do to improve your pelvic health today. Caroline brings a vibrant and super fun energy to everything she does, and this is no exception. I really hope you love this talk as much as I did. Okay, welcome, Caroline. I am super excited to have this talk with you today. So you and I officially met a few years ago in my Badass for the Long Haul course, but you recently moved to Truckee and we ended up meeting in town, and it took me, I think, a whole of 3 minutes to know that I really wanted to work together sometime. Yay. And so here's the first of it. I'm super stoked. So thank you so much. I love your energy. I love the energy you bring to this really important and super misunderstood topic. So thanks so much for being here and welcome.
Oh, thank you so much. I'm very excited and feel very honored that you asked me to join it, because I've looked up to you for a long time. Ever since I did Badass for the Long Haul, I read your emails. I'm like, she's rad. So
I'm
very happy to be here.
Good. I am happy too. Okay. So let's start off with, how did this become your life's work? Like, how did women's pelvic health become your total jam?
Yeah. So in PT school, we had just a 2-day lecture on it, right? And that sparked my interest and kind of stayed in the back of my mind. Like, that is really impactful work and something that I didn't know PTs worked on. And it's really interesting. And I had an interest in neuroscience. And so there's a bit of a marriage between the neuro and the ortho with pelvic floor. So I just really found it interesting, but graduated and went more into the neuro side of stuff. So I worked in neuro rehab for a couple years and then slowly made my way into outpatient. And then while I was an outpatient, I always kept, like, I could do pelvic floor in the back of my head because I remembered learning it and loving it. And so while that was in the back of my head that I liked it, I was also getting mildly burnt out on the like repetitive ortho world, and just like a lot of arthritis that can be tiring, and you don't get always a lot of outcome, right? And I was like, I think I'm ready for a change. So took my first pelvic floor course like 3.5 years ago, and ever since then have just loved it because of what I said in the beginning, like how impactful it is and how underserved it is, and underserved and not well known about, or like the education isn't there, and both to health providers and to women. So that's what made me feel really passionate about wanting to treat it, because there's not enough of us and a lot of people need it.
Yeah. And it's so misunderstood, because I think when people hear pelvic health, they think Kegels, like, and then that's it, like, have a baby, do your Kegels, be on your way, all is fine and good. And that's clearly not just what it is. So what is pelvic health? Like, what does it look like? What does it mean?
And one other thing on the misunderstood bit, like, it's not just the patients that don't understand it, the health providers don't understand it. I was listening to an interview with this sexual medicine doctor, who there was this cross-sectional study of primary care physicians, internal medicine, and OBGYNs, and 6.8% of them felt confident treating menopause. Like,
yeah.
Are you kidding?
Yeah.
Like, less than 10% of the providers feel comfortable treating it. So of course the people that are receiving it don't feel like they understand it either.
Right.
So
yeah.
What is pelvic health? So one thing that one of my sister, who just graduated with her women's health nurse practitioner degree, she was like, sexual medicine is medicine. Like, it is across the board. So when I work in the pelvic floor world, I'll work with patients prenatal or postnatal, right? Prepping for birth. And that can look like learning in the beginning trimesters, you do want a strong pelvic floor to hold up the pressure of the added baby that's growing in you, right? So you want to strengthen all that is holding up your organs. And that is both the pelvic floor, which is the bowl of muscles that connect from your pubic bone to your tailbone, right? And then hip to hip, as well as glutes and core and all of that. And then towards the third trimester, you want to learn to relax those muscles because that's what's needed to allow for the birth, right? Then after that, strengthening everything, right? That pelvic floor that we're just talking about, as well as the core and the glutes and all of that. So that would be along the prenatal, postnatal side of things. And then incontinence across the board, right? Whether it can have nothing to do with a baby and you can just be dealing with that at any age. So we work on that. Prolapse, which is a big thing and very misunderstood. We can take a deep dive into that. Should I just go into that now? What
No,
prolapse is? We'll come back to that.
Let's come back to that because
Yeah.
I love just kind of going through the list of what pelvic health means first and what it includes.
Right. So strengthening, incontinence work, working with people to help manage and or heal prolapse, as well as pelvic pain, which is a really broad area as well. It can be pain with intercourse. It can be just deep pelvic pain with movement, with exercise. It can be hypersensitivity. Anything there. So that's probably like the broad, and then as well, like into the menopause journey, but those symptoms are what I just said, right? So those symptoms can be because you're going through menopause, because you're postnatal, because you are just a ball of stress and you're holding it in your pelvic floor, right?
Right. Yeah. So many big points there. I mean, I love that last one you made, the connection between the nervous system and our pelvic health. So maybe we could touch on that later, because I really think that's super important. And then also how, I teach hormones for women and how having a baby is one of the huge hormonal transition times, yet alone the physical.
Right.
And then menopause is our other huge hormonal shift. And it's also physical because our muscles change, our weight sometimes changes, like so many things change, our pH, so many things that it also impacts our pelvic health again. And I see so many people who, what you said, they're starting to leak, incontinence. And then also libido. I mean, with the nervous system and the pelvic floor, and we need all the help we can get as our libido changes as we get older. So bringing that in too, I mean, just like so many really important things. So thank you for sharing that. You're hopefully spreading the word about this and teaching people that there's so many things you can do.
Right? So in that email you sent me, well, in just like some talking points we can touch on, one of them was like, what are we not doing? What are we not doing right? And I don't think it's us. Like it's not, and by us I mean the patients, right? Like we're not doing anything wrong. We're just not being educated on where to go. Like people don't know that you don't have to live with that discomfort. You don't have to live with leaking. You don't have to live with dryness that is uncomfortable. It's not just sex that's uncomfortable when you're dry. Like it can be prohibitive to exexercising, for going for a
mountain
walk,
biking,
for playing with your grandkids, for like going on a road trip. It's like the what's wrong is the advocacy for that person that they have to live with it, right? It's because the message is this is aging, deal with it, then it's underreported in the doctor's office, right? So like only, I've read different things, between 50 and 25% of women report their GSM, genitourinary syndrome of menopause, right? Not everybody reports their symptoms. So then because they think they have to deal with it, so then it's undertreated.
And it's, it's like there's so many things probably compounding the problem. One of which is our medical system doesn't currently know how to handle this.
Exactly.
And how to address it.
6.8% of them.
And so then it just like trickles down. So then so people just don't think it's serious, or like you said, they don't know what to do. So so yay for you again, getting it out there. Thank you.
I feel like every other sentence I'm like, getting on a soapbox again.
Yeah, great. I love it. Get on it. And I am your biggest advocate. So really, really important. So
Right.
do you want to talk about prolapse now?
Yeah, I do. We can talk about prolapse because I think that one, when I look at my patients, they are the most scared of that one. Or if it's happening to them, they're the most scared of what's going to happen. So prolapse is if you were to imagine your, I've heard this analogy before. If you were to imagine your vaginal canal as like a tube sock and the top is your cervix, your bladder's in front, your uterus, if you have one, is on top, right? And your rectum's behind. And it's a weakening in the layers that then the bladder, if we're talking about a bladder prolapse, pushes into the vaginal canal. And so if you are at a stage that you can like feel something falling out, it is not your bladder falling out. It is your vaginal canal. I feel like that is the first thing that people are like, oh, thank God, I thought my organs were falling out of me. They are not. They are just the strength, the elasticity has weakened so that you're having that pressure downward. It can feel like pressure, heaviness, sometimes back pain because of the muscles and ligaments that are supposed to hold it up. If they're weakened and then we're having more pressure downward on them, it'll pull on your sacrum, right? So you can have some back pain from it. You can also have incontinence or difficulty emptying. So those are some of the main symptoms of it. And it is very treatable with multiple disciplines, right? So pelvic PT is kind of the first place to come. And we use a lot of different things to attack it. It might be more of an aggressive word than I want, but multiple ways to treat it and to decrease symptoms. One is, I say this word a lot, or phrase a lot, pressure management, right? So if you are, say you have a job that, or a lifestyle that involves a lot of lifting, say you are postpartum and you have like a 3-year-old and a baby, right? And a lot of lifting, bending, lifting, twisting, repetitive lifting, you are not feeling strong after having a baby, a lot of weakness kind of generally, right? And so you'll be holding your breath, bearing down, putting a lot of pressure downward. And that can be one of the reasons for this prolapse, right? So with that patient, we'll work on breathing. We'll work on rib cage mobility because right after you've had a baby, your ribs have flared open so that then we lose this mobility here, right? I'm like, right, if your ribs flare here for the baby and then they stay out and they get stuck there, we want to work on being able to mobilize there. We want to work on your breathing when you're lifting, and we want to work on full body strength as well as pelvic floor strength. So that's kind of like a very small idea of a younger patient, right? Or you can see prolapse in menopause or perimenopause, postmenopause because of the hormone changes, right? And because of what that does to muscles everywhere, including the pelvic floor, right? So we'll have some weakness and increased chance of prolapse then. The treatment style is similar. I look at all of those things with everyone, right? I want everybody to be strong everywhere, right? If you're not strong, then it puts more pressure downwards. So that is full body strengthening, lifting mechanics, breathing, rib mobility, spine mobility, core, all of that stuff is how we work on it. We'll talk a lot about bowel and bladder because constipation is terrible terrible. With my patients, I wouldn't make it sound so drastic, right? I try and use very gentle language because everybody that comes in is scared anyways.
But it feels terrible to them.
Yeah, big time. So things that constipation is a big one too. So making sure that, and then that's where we'll refer them back to you because I'm like, we need to dial this nutrition. So I'm going to talk about position for evacuating your bowels and the important bits, and we'll talk a bit about nutrition, but then you are the expert in kind of I don't know if it was on recording or when you and I were just chatting, but the importance of having an awesome referral network. That's why you're great. That's why we'll.
Yes, totally. Complement each other and really help each other because this is really big. I work with so many people where these are all really big problems.
Yeah. Yep.
And as that estrogen changes, you can kind of be skating along, even if things kind of were a little bit wonky, but we're sort of skating along, and then estrogen drops, progesterone drops, your body composition changes, everything changes, and things can emerge again. So yeah, those are all really important tips. And I just want to say, I really love the way I've always thought this. And then every time I talk to a physical therapist, I am reminded of this. Physical therapists naturally think functionally because you don't just see the problem, the pain or the incontinence or the prolapse or, the orgasm, whatever it is, and try to just quiet that. You guys are always looking upstream and thinking, okay, why did this happen? How can we influence this in other ways? How is the nervous system involved? How are day-to-day things involved? Posture, repetitive movement, and how do we slowly take steps to improve how the whole body system is functioning?
Yeah.
And then when you do that, it impacts those symptoms that are really at the very end of all of this change and dysfunction that's happening. So I just love that. I think physical therapists are really unique in that way in our traditional medical system.
Yeah,
So,
thank you. And if you work in the right office that allows for you to have time with the patients, then I feel like we are like a health provider that gets to spend a lot of time with the patient, right? Where, like I mentioned, my sister, as a women's health provide like a nurse practitioner in the clinic she worked at in DC, I think she got 15 minutes with her
yeah,
patients, right?
yeah. I had a nurse practitioner on last week, and it's the same with her. No matter how thorough and good of a job you want to do, in 15 minutes, it's pretty darn impossible.
Absolutely. So, like, you want to figure out what's going on upstream. You're not going to get that done in 15 minutes. Like, I, a full subjective, right? That's where the patient, when I sit down, I'm like, tell me what's going on. You want, like, for pelvic floor patients, there's usually a lot they need to say, right? Because typically they have been living with this for a long time and it causes a lot of stress. So you need to sit there, shut your mouth, and let them tell you what's been going on. And then you're going to start to hear, like, again, using that word, how is their nervous system? You'll get a feel if you give them time in the subjective. But if you are seeing a patient every 15 minutes and your nervous system is jacked up, like you're just treading water all day, then you're not going to be able to let the patient feel calm to tell you what they're going through, right? If you've like got your hand on the doorknob the whole time you're with them.
Yeah.
So,
And so could you speak into how the nervous system impacts pelvic health and the pelvic floor?
absolutely. So vagus nerve is a trendy nerve and gets a lot of attention, but it's also really, really important and really impactful, right? So you have your sympathetic nervous system, your parasympathetic nervous system. And I will be, kind of simplifying this, both because admittedly, I know the more you read about it, like the more you realize you don't know, right? So I just took a vagus nerve master class and you're always like, now I need more. Now I need more. Anywho, so sympathetic is that fight or flight, that go get them, right? And the parasympathetic is the rest and digest. And your vagus nerve is one of the main contributors to that parasympathetic nervous system, right? It's one of the cranial nerves, comes out, kind of travels around your ear, down your neck, behind your collarbone, and down into all of these organs, right? And so when people are in that fight or flight stage, they will be tense, right? So like take the pelvic floor out of it. My mom, she can be tense and she's like, my shoulders always hurt, my neck always hurts, right? And so it's this tenseness, right? But there's been studies that show if you're here tight and then your jaw clencher tight, then they find a direct correlation to pelvic floor tightness too, right? And so if your pelvic floor is really tight, it can't function like it should. It doesn't have the coordination to relax and contract, right? So that's kind of why Kegels aren't always the answer, because that's just like contract, contract, contract. We don't have any coordination. We need to be able to relax and contract, right? So when people aren't able to upregulate their parasympathetic, right? When the sympathetic's up here and the parasympathetic's down here, we're not able to find the relaxation, which is full body, which is down to the pelvic floor. I don't know if I described that well enough, but like when I'm working with a patient, I describe it as a dimmer. And I'm like, we need to dim down the sympathetic and turn up the parasympathetic. It's kind of finding this balance. I'm not saying shut one off and turn one on. It's just like, we got to find a better balance.
Right. You need to be able to initiate that stress response
Yeah, of
and
course.
then bring it down and come back into calm most of the time. And the truth is, most modern day women are not going there. We are achieving so much and doing so much and go, go, go. And that's what success looks like.
Right. They're like 1 hour of self-care a week is coming to me. And it's like, that's a rough self-care,
right.
you know?
Right.
So, and that working on the nervous system is across the board in all PTs, like in all diagnoses, right? Like, because at my last job, I was maybe 50-50 pelvic floor and general ortho. And I had this patient who had bad neck pain and like constant neck and shoulder pain. And she sat with her shoulders up and she hardly moved her mouth while she talked. Like her jaw was tight and her shoulders were tight. And like and her range of motion was fine, right? And then I let her talk and she goes, when people take their subjective history back years, I'm like, okay, we've got some unpacking to do, right? She was in her 30s and was talking about high school. So I'm like, okay, we're still holding on to some of that stuff. And we did breathing activities. We did breathing exercises. And then I'll do some like manual hands-on work trying to stimulate the vagus nerve to help calm it down. And that helped her neck pain great. So it's like, it's everything, right? The nervous system is everything.
It's everything. Actually, it's funny. Another week we talked about digestion and it was about the nervous system and digestion. Yes. So really, yeah, it is everything.
Exactly. Right. So like, because the vagus nerve is involved in so many of our organs and a lot of that digestion. So like that digestion and bowel and bladder question.
And libido and orgasm. I mean, you cannot have an orgasm if you're going to be tense and your sympathetic nervous system is on. And so again, menopause, hormones go down. We need all of those little things to be helping us out instead of.
Yeah. I have a question for you. When you work with your menopausal clients and they're dealing with all this stuff, what do you do in terms of diet recommendation for hormones, right? Because more what I know about are the hormone supplements, vaginal estrogen or like a patch estrogen and stuff like that. So what do you do?
Yeah, those are a really important part of the equation. But so that's what I teach in my hormone class is sort of like the pillars of hormone health. So we just sort of look at it kind of like how a PT does in all honesty. We go upstream and we say what impacts hormones. The microbiome impacts hormones. So we need to get that dialed. The nervous system impacts hormones. Stress is our bossiest hormone. Blood sugar impacts hormones and changes when hormones, sleep. And then, so we do all of those things. And of course, we need to be eating for our ovary health. So we want to have healthy ovaries as long as we can before, menopause and they shut down. So we eat for that, so we have a bunch of foods, sweet potatoes and sardines and olive oil and olives and avocados and all these yummy foods to really feed our ovaries and antioxidants. But really, it's a lot rooted in blood sugar. And when you look at all those other things, it's like, it's just kind of easy to see what a good formula is for healthy hormones. And then of course, it's a little bit different for everyone depending, but.
Right. But that's amazing. Like that should be the standard of care.
Right. It totally should be. And we don't understand how all these body systems are connected for pelvic health. For hormone health, we have all these specialties and they're not working. The more specialties we have, the less we're seeing the whole person and really impacting all those things.
That woman, I think I mentioned her to you when we first met, Rachel Rubin, the sexual medicine doc she works in DC. She told this little anecdote. She was like, Oprah Winfrey was going through menopause and was having heart palpitations and went to 5 different cardiologists.
Yeah.
And nobody thought that menopause had to do with it, right? And if Oprah Winfrey's doctors can't figure it out, then like, what's happening with the rest of us?
So hopefully that's changing. I mean, it's changing pretty quick.
Yeah.
But But yeah, so it's so
It's
true.
kind
So wait, I have a question. Can you
yeah.
explain? I recently heard about this breath, and I was really wanting to ask you about it. It was this simple breathing exercise for your pelvic floor. And it has something to do with inhaling and exhaling,
Mm.
drawing up your pelvic floor and then melting it down or
Yes.
something. It seemed
So
really important. I would love to hear
it
about
is
it.
really important. You're
Okay.
right. That it like I don't know if I have a pelvic floor patient that I don't talk about breathing with. It is imperative to start with, right? So your diaphragm and your pelvic floor make the ceiling and basement, right, of your core canister. It's kind of the way I describe it,
I like
right?
that visualization.
Yeah. And they work as a piston. So if your diaphragm, I'll back up a little bit here, stand up, either because I am a visual person, right? So if your diaphragm sits under your ribs here, kind of like an umbrella, and your pelvic floor is down here, when you take a breath in, your lungs inflate, right? And your diaphragm moves down. You get a little, and I'm exaggerating with my hands, right? But you get a little bit of a relaxation, a downward movement of your pelvic floor as you breathe in and your diaphragm moves down. And then as you exhale, diaphragm lifts up as the lungs expel air and your pelvic floor lifts up. So while we're doing pelvic floor strengthening exercises, so that'll be a place to start, right? Like either sit on your hand or sit on a ball or sit on a washcloth so you get a little bit of tactile feedback to what's happening at
Mm.
your pelvic floor,
Mhm.
and you do this breath work. And mental imagery is really powerful, so we'll go through that. And then it translates over to exercise, right? Whether we're doing pelvic floor engagement or we are doing bridges or squats or lifting or lunges, the exhaling on effort to feel your pelvic floor engage and lift up is really important. Does
So that's
that
like
make
one
sense?
super, yeah, that makes perfect sense. And I love how you
Yeah.
set up. So if you're not watching this on
Yeah.
YouTube, if you're listening to the podcast, you can head over to YouTube and
Yeah.
watch
Or just
Caroline
like
as she demoed that. It was really, really interesting. But it sounds like that's something we should all just be doing.
Mm, right. And so then that bit is really important in the pressure management bit, right? If you have that's where so many of my patients start. We are lacking the coordination of our pelvic floor engaging with us as we're doing functional stuff, right? So yeah, and it is really important and a simple place to start.
Yeah. I mean, I used to teach yoga. I'm a women's hormone specialist, and I just learned that.
I
I mean,
know.
what? I feel like like you just need to go teach everyone how to do that for just basic start here.
Yeah.
And then that could probably resolve a lot of issues.
It
And then,
does, and it really does. And I do feel like the education and the demo of it to get some buy-in, because if
mm,
someone's coming in and they're
mhm.
like, I am peeing 25 times a day. Don't talk to me about breathing. Fix my pelvic floor. And I'm like, no, no, no,
Yes.
listen, this part matters. Like just give me this 5 minutes
Yes.
because it matters. Yeah.
Yes, absolutely. Okay, so that is one huge thing people can do. Do you have anything else that people
Hmm.
can work on
Yeah.
to address pelvic health and, prevent some of those problems or reduce some of those symptoms?
Some of the basic education I learned back in PT school, right, which does still stand true today if we're talking about continence, incontinence, frequency, that stuff, right? When we go, every time we get the slightest urge to pee, or every time we leave the house, every time like there's any and oh, I might not be by a bathroom for 20 minutes, I'm just going to pee now. That is retraining your bladder to empty and to empty and to empty. And it retrains it to think that like maybe 50% full is now my new capacity, right? And it retrains you into this high frequency. Whereas if you really only go when you have to go and stop going before every time you go to the house, leave the house, that'll retrain you to be able to hold your urine. And even being able to wait until the second urge, right? Because talk and function, right? If you are in the middle of the grocery store or in the middle of a drive and you get an urge, you have to hold it, right? I mean, really, you do, unless you're at a point where you can't and you're wearing pads, it depends. Then like, yeah, okay, well, we can talk about that. But just to prevent leaning into this really high frequency, high urge, inability to hold, stop going all the time.
I
So
love that. That's great. And
yeah.
it makes me think of so many analogies that I'm not going to talk about, but I love that advice. It wasn't actually what I thought you were going to say.
Yeah.
Um,
I mean, it's just an easy place to start,
yeah.
and and it's a universal rule, right? Sometimes I can have a harder time thinking about like what should everybody do. I mean, aside
Yeah.
from breathing, like strength training, super important, especially if we're talking perimenopause, menopause. Like strength training is so important, as well as the yoga, right? We need to like, because what you said, stress um is hard on the hormones, right? What did you call it? Stress is like
It's
the
the
biggest
bossiest
bully.
hormone. Yeah,
Bossiest
cortisol.
hormone. Yeah, yeah, exactly. So you want to manage your cortisol and get strong. So like yoga and strength training is imperative for the menopause people. That can be a really easy universal statement for them. But for just like that frequency that I see in my friends, in my mom, like stop going all the time. But I also
Mhm.
tell them practice this, because when they're in my office, they're there because we are now at a place where
Yeah.
it's a problem, right? So that blanket statement was for people to prevent coming into my office, right? But if they're in
Mhm.
my office, I'll tell them practice this in a safe place. I'm not telling you to go to grocery outlet and do a huge shop and like don't pee before you go there, because I'm not wanting you to I don't want you to fail. I don't want you to leak while you're grocery shopping, right?
Right, right.
Start it in the house.
Right. That's great. I really like that. So those are two really concrete things that everyone can do. Do the pelvic breath.
Yes. Yes.
Um,
Do the pelvic breath. Do
Stop
that.
peeing every second. If you can, work on that
Exactly.
ability to hold it.
Mm-hmm. Mm-hmm. Um, and then the research has shown that your pelvic floor muscles engage when your glutes engage and when your lower abdominals engage, right? They and they work together. So that's why one of the reasons why Kegels aren't enough, right? Because Kegels are a volitional movement, a volitional task. Whereas our whole lives, our pelvic floor was working without us having to think about it all the time. So we want to get that automatic function back. And that is working on the coordination of engaging with your transverse abdominals, those deeper muscles, with your glutes, with your deep hip muscles, right? This coordinated task is where I go pretty quickly because of the function, because Kegels aren't that functional.
And
I
that's
don't
what you probably do a lot one-on-one with people, right? It's like
exactly.
really help them to, yeah, I want to come see you. Like we all
Yeah,
need to come see
of
you.
course, exactly. Yeah, we'll do what it can look like a pelvic floor PT assessment and treatment, and an internal assessment, right? But I always make it an option. People need to give me a resounding yes that they want that, because otherwise we can do it another way. I don't want it ever to be something that they feel pressured into, right? So if it's not internal, we'll work around that. But if it is, then we start on the table, and I will, right, use a glove, have one finger, lubricant, and I go internally, the vaginal canal, and feel the different layers of the pelvic floor. Feel them engage, feel them relax, all of that stuff, right? And that is there's like a standardized measuring, right? And then as long as they're again game, resounding yes, we get off the table. And I still do an internal assessment while they squat, while they stand on one leg,
Oh,
while they
wow. That's
breathe,
awesome.
because that's the function, right? And it's like
Hmm.
lay on your back and I do start with like bridges, right? Those are important, but if we want to like really make the gains, then I need to see what's going on when you are leaking, right? You're not leaking when typically you're not leaking when you're laying down. You're leaking when you're doing stuff. So I want to see that.
Yeah, that's brilliant. And then I'm sure, do you feel like imbalances on sides or
Yes,
like,
yes, yes. Mm-hmm. Yeah. To speak of this one patient I had, she had a lot of pain. She had bowel issues. She had anal fissure. She had a lot of pain with pooping. Obviously, anal fissure hurt, and then she had a ton of pelvic pain, vaginal pain. Hadn't had sex in years, right? And so I did an internal assessment, and I was like, then I come out and I'm like, what's going on in your left side that you didn't tell me about? And she was like, oh, I broke my ankle. I tore my ACL.
mm,
I've had hip pain for a while. And that's when, right, I'm like, okay, we're going to do a timeout on the pelvic floor stuff. We're going to work on your foot. We're going to work on your knee. We're going to work on your hip. we're going to work on your breathing. She took a medical leave from work because she was so stressed, and like everything got better. It was amazing. I felt like a
That is
magician.
brilliant.
I
Yeah, that
know.
is really cool. That is really
Yeah.
cool.
Mhm.
And it's, I mean, I just thought of the fact that my husband, he's in the ER and he's always saying how many women come in with pelvic pain. And he's
Mm.
always like, "Ugh." I mean, again, like we need to be seeing our physical therapists, our pelvic
Yeah.
floor physical
Yeah.
therapists first, because I don't think, again, people even know. So thank you
Right.
so much for explaining this. What would you want everybody to understand about, and speaking more to the midlife woman plus, since that's who I mostly work with,
Right.
what would you really hope they understood about pelvic floor health?
Hmm. I think I'd want them to understand that, and I hope I don't, yeah, that it's very comprehensive care, right? By working on their upper body strength, they're helping their pelvic floor. By working on their lower body strength, they're helping their pelvic floor. By meditating, they're helping their pelvic floor. Like it is just part of our body. And what do that general strength, right? Our pelvic floor is a place that can be like load that the rest of us can't handle gets dumped there, right? So if we are not strong enough to bring the groceries into the house, that can land in pressure in the pelvic floor, right? So that is why strength training is important. And if our hormones are not in balance and our diet is not in balance and our bowel and bladder is not healthy, then that will have an effect there, right? So it really is this full body care. I think is does that answer make sense? That
Yeah, it makes so much sense. And it's so fundamental and so primary because
yeah.
it's like our posture, right? Like
Yes.
everything, our nervous system, like
Exactly.
all of these things influence it. And what you're telling us is that we don't have to have these symptoms that we think are normal. We don't
No,
have
okay,
to
actually,
leak.
no. Forget everything I just said. That's what I want women to know.
Oh. Well,
That's
that's
what I
what
want
I
people to know.
take from you. I mean,
Yes.
that's what when you speak, that's what I hear also is those are both really important points together. So it doesn't have to be normal and there's tools to fix it.
So many tools, so many tools. There's me, there's you, and then I really like, I wonder if you and I together could do like a lunch and learn with some of the docs over at Tahoe Forest because like estrogen is so important and the vaginal estrogen, the topical estrogen, I mean, Rachel Rubin, that doctor, she's like, it saves lives. It decreases UTIs. UTIs kill people, right? UTIs, if you, well, first of all, they just kill people, but like, say you've got really high frequency because of UTI and you're waking up 7 times a night, and then you trip and fall and break your leg. Like, they're terrible. And vaginal estrogen can stop that. And people are scared of estrogen because there was some terrible study
Hmm. Hmm.
done. I'm sure you're familiar with the Women's Health Institute
Hmm.
did this ridiculous. Well, anywho, it wasn't a terrible study. It just
It was a terrible
was
study. It was a misunderstood
it was a
study.
misunderstood study. Yeah,
Yeah.
it had good intentions,
Yeah.
but the way they presented that data like stopped treatment for menopause, basically stopped
Right.
hormone treatment for menopause, which is
Yeah.
really good
So helpful. Yeah.
Yeah, yeah. Did you
Absolutely.
read that New York Times article? I think it came out a year ago. I'll send it to you. It was long. I've been listening to it actually, and it's just about the history of menopause treatment in America.
Yes.
It was
Yes.
great.
Yeah, it was awesome. And I think we're headed in the right direction.
I agree.
More
I agree.
research, more doctors are coming on board, but we need this functional thinking that you provide and I provide beyond just the estrogen patch also or the
Right.
topical
Right.
estrogen. So
Yes.
teamwork, like we started
Hmm.
talking with the two of us, we all need a
Exactly.
team.
Yeah.
And well, thank you so much
Yeah, of
for
course.
joining
Thank
me
you.
today and sharing
Thanks
your
for having
wisdom
me.
and keep staying on your soapbox.
Yeah. Yeah, it's important. It's so important. I
Anything else you want to mention before we sign off?
don't think so.
This was awesome. Thank you
Okay,
so
great.
much.
Well, thanks,
Um,
Janelle.
That's it for this week. If you enjoyed this podcast, please leave a comment and review, as that helps more people find out about it. You can find me and the courses I teach at mountainrebalance.com and on Instagram. If there's a topic you want to hear about, please reach out and let me know. That's it for this week. If you enjoyed this podcast, please